Now the next portion of our test, Rob, is called palpation. And in the spine, you have 24 movable bones. And when injuries and trauma happens, part of that adaptation is that spine literally shifting out of place. And if it shifts, it can irritate the nerves, it can create swelling, and that typically leads to sensitivity. So I'm going to try to identify those weak links in your spine by pushing on the bones. Now, typically bones aren't sensitive.
Sure.
You know, you push on your head, it doesn't hurt, it shouldn't. So when I push on the spine, I'm not going to push so hard that it should elicit pain.
Right.
I'm just going to put enough pressure that it should feel like pressure.
Okay.
However, a subluxated or a partially shift vertebra becomes more sensitive. And that's all I'm trying to identify, is where those sensitive ones are.
Okay.
So I'm going to start right here at the top of the spine. We're going to push on the right side first, behind the ear, and when I push there, we'll kind of compare that to the left side. Does either one of those or both of them feel sensitive, or do they both just feel like pressure?
A little sensitive.
On which side? So more sensitive on this side. Now that's interesting because that controls a lot of the sleep centers and has a very strong effect up into the sinus cavities and can affect headaches. You have a few of those, don't we?
Yeah. All of them.
Let's come to C2. Any sensitivity on that one right there?
Slight. Yep.
Okay. How about C3?
Very, very minimal.
Okay, so it's actually getting better. How about C4? Now that's interesting because you can really identify the difference between a healthy one and a shifted one. Can you feel that yourself?
Yeah, absolutely.
Again,
Absolutely.
this is important for me that you feel it just as much as I need to know the information.
Yeah.
Now when I come into C5, any sensitivity there?
Not really, no.
Okay, how about 6? Good. 7?
No.
Okay, we're going to come down into T1. Any tenderness there?
A little bit, yeah.
At T1, and we begin to get into some of the mid to upper digestive issues. How about 2?
A little bit.
Okay, 3?
More so.
Okay, and 4.
That one hurt the most.
Now that's digestion. That's that heart, lungs, digestion. And if that's sensitive, guess what organs are under stress?
Well, the stomach and
Do you have any problems with that?
yeah.
We identified in the exam. Your
Yeah.
most important was acid reflux.
Yep, absolutely.
So do you think there's a direct correlation there?
Yeah, absolutely.
Very much so. If I come down to T5, any sensitivity there? 6?
Nope.
Stop me if I hit one. There's 7, 8, 9, 10, 11, and 12. A little on 11 and 12. So that's kidneys, and so we've identified some of the stress into those. How about L1, L2?
Yeah, bad right there.
There's large intestine. L3, L4, or L5.
Nope.
Yeah. So we talked about some of those lower digestive issues and some of the back pain, but primarily the acid reflux, the sinuses, the fatigue, the sleep disorders. It helps us identify those. So out of those 24 movable vertebrae, we have 7 of them that are inflamed and in pain because that's where our weakened structure is now driving all the stress.
Okay.